Dr. Binduraj, you can take
Thank
over
you,
the
Dr.
class.
Mridul Sahani. Thank you, Mr. Sandeep Peters, and thank you all. And it's the time to start the international session. And it's the 1066th day of the uninterrupted daily webinar of IFPH. Before beginning the session, let's have a silent prayer. Hello, doctors, students of homeopathy, and friends of homeopathy. Today is the 1066th day of the uninterrupted daily webinar of International Forum for Promoting Homeopathy. And today's our guest is Dr. Gurukiran N. He have graduated BHMS from Government Homeopathic Medical College and Hospital, Bangalore, affiliated to Rajiv Gandhi University of Health Sciences. He is a classical homeopathic practitioner in the district of Chamaraja Nagar in the state of Karnataka. 15 years of clinical experience, an independent researcher, post-graduation fellowship in SCPH, International Center for Homeopathic Medicine, United Nations, presented papers in homeopathic approach for the treatment in different type of cases, especially psoriasis, thyroid problems, PCOS, epilepsy, hypertension, respiratory disorders, parahemophilia, GERD, alopecia areata, infertility, etc. Presented papers in DD Chandana on various skin disorders. And today's topic is importance of repertorisation, case studies. Let's welcome Dr. Gurukiran, and I welcome you all for the session. Thank you.
Thank you, sir. Thank you for the warm welcome. Am I audible, sir?
Yes, you are. You are.
Yeah, fine. Yes. Good evening and good morning to all the participants of IFPH. And today's session is importance of repertorization, case studies. How the repertory is important in our daily practice. As we all know that it's a very, very important topic. Repertorization becomes and plays a major role in solving the problems of cases. And I have chosen 5 cases today to show how can we crack the case and to prescribe the minimum. Before that, I would like to take blessings of Dr. Samuel Hahnemann, the mission of physician. Because of him, we are all here today. And when we speak about repertory, we should not forget Dr. von Bonninghausen. He's called as the father of repertory. So I would like to seek both the stalwarts and both the masters' blessings for the today's session. Let's move on to the next slide. That where can we find about repertory or repertorization in organ of medicine? In which aphorism can we get this information? Yes, in the aphorism 153 footnote. There, Dr. Hahnemann says, Dr. von Bonninghausen, by the publication of the characteristic symptoms of homeopathic medicines and his repertory, has rendered a great service to homeopathy, as well as Dr. J.H.G. Jha in his handbook of principal symptoms. He recognizes the Bonninghausen's work for the repertory. So, we have studied the repertory in the final year BHMS. And what are all the types of repertorization do we have? So, I've picked this point that broad physical generals and mentals, what we consider as constitutional, and characteristic symptoms. We repertorize through characteristic symptoms. Also by generalization, and also by using special repertories like Nair, Clark, Roberts, Special, Watts, etc. Lot of other repertories we have. So these are all the types of repertorization we use in our clinical practice to crack a case. So what is the modus operandi? When we look at a case, we have to look for peculiar symptoms that he has written in aphorism 153. Then we should also consider the level of the case, but what level the case is, and it should be detailed case taking. This becomes a very important point where when we have to repertorize, when we have to make a totality in the case, detailed case taking should be there. Until and unless without any details of case, we can't repertorize or we can't crack a case. So that when we take the detailed case taking, then we can form a totality of it. Then we can show the importance of repertorization by repertorizing it. Then the simillimum will be easier for the prescription. That should be the modus operandi. See this. Can you see the picture? What it is, what it signifies. When we speak about repertorization, what does it speak? You can chat it in a chat box. You can enter the points in a chat box so that it will be easier to interact. What is the significance of this picture when we speak about repertorization, importance of repertorization? Can anyone enter the chat box and type it? Or shall I move on? Okay, fine. So this picture signifies when a patient comes to your clinic, he sits in front of you, he starts narrating his symptoms. This may be the symptomatology, the symptoms what he can narrate to you, this kind of symptoms. So what is the physician's work here? To select the important symptoms, convert into rubrics, then repertorize it. That's what the picture says. Lot of symptoms. When you go in detail to see this picture, then you will understand in depth, in detail. When you zoom it, you can see the very detailed picture here in this photograph. That's what it signifies. Otherwise, what it happens, it looks like this. It will be a bizarre picture. The physician can't understand the symptomatology. So it looks bizarre, blur. The patient will be narrating his symptoms. There we have to pick the symptoms for the repertorization. Otherwise, it looks bizarre like this. So, broad physical generals and mentals. One of the traditional way of analysis, which we call as constitutional approach of analysis. It should be broad physical generals and mentals. Have to take into consideration. Approach is to take main symptoms from different areas of the case. This should be the approach. In this, broader polycrest or well-proven remedy comes after repertorization. For this method, we use Kent, complete, and synthesis repertories. Usually, we rely on these kind of repertories. This should be the approach. This should be the picture, whole picture. And again, we have to see the level of the case and what type of case it is according to that. So, after all this, I move on to the cases now. Through cases, through case studies, I'll show how important the repertorization is. In each and every case, we should repertorize and arrive at the simillimum. A case of pityriasis alba. A very small introduction that we all know, just to brush up the topic of this. Pityriasis alba, also called as pityriasis simplex, occurs mainly in the children. Clinically, it presents as an asymptomatic hypopigmented, ill-defined macules, usually on the cheeks and other parts of the face. It's a self-limiting disease that we all know this. And treatment. What about this? Many patients may not require any treatment except assurance because it is self-limiting, as they say in the text. So, when we have a case of pityriasis alba, can we take the case or we just assure the patient that it will go away? Please wait, have some patience and go. Is this a right treatment, or we have to start treating with homeopathic medicines? What can we do when we get a case of pityriasis alba? Let's see. A male boy aged about 12 years was presented with white patches on the face since 1 year. Very occasional itching. The patient has shown to multiple dermatologists and have applied plenty of ointments. The lesions which started on the cheeks, now after applying lot of ointments, has shown to multiple dermatologists, the lesions started to spread all over the face. What he did? The patient got fed up and stopped everything for a month. After 1 month, then he came to me. The patient opted for homeopathic treatment. Can we take up this case, or shall we only assure the patient and tell them that it's a self-limiting disease, you don't want to worry, it will go away? He is suffering since a year and he has been to a number of dermatologists and he has applied lot of ointments, creams over the face, but without any result. The patient got fed up. This was the photograph of the patient when he came to me. After treating with lot of ointments, lot of other medications for 1 year, also he has stopped the medicine before coming to me. This was the case of pityriasis alba before homeopathic treatment. Now, when he comes to us, then we start eliciting the symptoms. So, first we have to decide what is the approach to the case. It should be constitutional. We have to see the level of the case, that it is chronic, deep-seated disease. It has not gone since 1 year. The patient has fed up with all kind of other treatments. The approach should be very, very important. So, after started eliciting the mental symptoms of the patient came to me introverted, anxiety about health, especially about his skin condition. He has got the fear of speaking in the public. I have taken only the main important symptoms to present for today's session. Physical generals, he was having desire for warm food and warm beverages. The patient is thirstless. Thermally, the patient is hot. What can we do now? After taking these symptoms, directly we have to go for repertorisation. See how important is repertory. Can we analyze this case after making a totality of the symptoms? Yes, it is. The patient is introverted in nature, fear of speaking in public, fear of responsibility has got, anxiety about health, desire for warm food and warm beverages, thirstless, face eruptions. What does the repertory shows after analysis? It is lycopodium, covering almost all the symptoms. Totality is 21 marks. Can you prescribe that? Yes. This is the picture of lycopodium. Lycopodium, 200, 2 doses for 15 days. After 1 month of homeopathic treatment, patient came to me. This was the condition. The hypopigmented macules started to reduce. After 1 month, the other part of the face started to reduce. Few months later, 1 more dose of lycopodium 200 I have prescribed. See, totally cleared, vanished within 3 to 4 months of right constitutional treatment. So this face again. The boy and his parents were pretty happy having seen this kind of result. So just for a discussion, we may discuss in the later. If this case is a spontaneous remission, why it did not remit during the 1 year of other treatment while applying plenty of ointments? If they say it's a spontaneous remission. If this lesion would have disappeared due to assurance, why didn't they assure during the 1 year treatment? If there was a chance, it would have disappeared during the 1 month after stoppage of ointments. Why in that time also it has not disappeared? Just for a discussion, let me discuss the last cause. Next, move on to the second case. A female aged about 13 years was presented with multiple joint pains since 2 years. Severe weakness, which used to aggravate after exertion, running, walking, playing. The patient has been undergone other forms of treatment without any improvement. Physical generals. Appetite and hunger decreased. Desire for sour foods, sweets. Thirstless. Bowels constipated. Sleep is disturbed. You imagine, at the age of 13, she is having a lot of problems. Thermally, the patient is hot. So, then, about the gynec history, the menses flow to be very copious for 6 days. Mental symptoms, the patient is introverted in nature. The patient is very reserved. She is oversensitive. Desire for stimulants to smell, especially shoe polish. She would love to smell those kind of stimulants, especially shoe polish. So what can we do? The reports are in front of the screen. See the hemoglobin level, it is 7 grams. Vitamin D is deficient. Vitamin B12, which is also less, 110. Analysis, after taking that, after considering mental and physical generals, she is introverted in nature, she is reserved, thirstlessness, constipation, desire for sour food, desire for sweets, pain, joints, menses copious, stimulants, desire for stimulants, and weakness on exertion, aggravation. So this is the importance of repertorisation. When you take the case in detail, properly, making a totality of the symptoms, totality picture is repertorized in repertorization, and it will guide us to the simillimum. So, can we prescribe pulsatilla? Yes, this is pulsatilla. I have prescribed pulsatilla 200, 4 doses per 1 month. After 3 to 4 months, see the vitamin B12 has come to normal. Serum calcium has to improve 7.8. Vitamin D has improved well from 10 to 14. See, after that, hemoglobin, it was 7 grams. Now it is 10.9 in the month of April. Then the treatment continued. I had given pulsatilla. This is a recent report, last month report of July. See, the hemoglobin has become normal, 12.3, and also the serum calcium level has raised to 10.2. Vitamin B12 was normal in the last report itself. So that is the power of right constitutional approach to the cases after repertorization. This shows the prominence of repertorization. Next, move on to the third case. This is also a very interesting case. As I said earlier, there are a lot of approaches, depends on the case and the level of the case. This is a case of fissure in ano. A female aged about 24 years was presented with the symptoms of burning per rectum after a stool and pricking sensation during stools since a week. A known case of fissure in ano since 6 months. The patient has taken other treatment and has applied ointment without any satisfaction. So what can we do now? We repertorize this. What is the symptomatology? Rectum, pain, burning, stool after, and also concomitant during stool, rectum pricking sensation. So the important striking symptoms has been taken into consideration and repertorized. What is the result after repertorizing it? When we do not repertorize, only by asking the symptoms, when we jump into prescription, we may fail in the prescription in arriving at the simillimum. When you repertorize, we may guide to the simillimum. The prescription is magnesium mure, 202 doses for 15 days. Just 15 days. After 15 days, she came back. Now she is burning pain, pricking sensation has disappeared. When we get these kind of striking symptoms, please consider it, make it a totality, please repertorize it, then the prescription will be easier. The cure follows. Another case, the case of post-viral cough, post-viral infection. A male aged about 75 years was presented with cough without any expectoration after influenza fever. The cough was very, very irritating to the patient. He has tried some of the medicines in the home remedies, without any relief. The sleep was disturbed due to cough. Only it started after influenza fever. Let me take that. Cough, dry, influenza after. This is a strength of repertory. We have to look into it. We have to search in the repertory. Only a single remedy rubric, cough, dry, influenza after, that is lachesis. Prescription is lachesis, 202 doses for a week. After that, patient cough has disappeared with a sigh of relief. Only 2 doses. Just after 1 week. This should be the approach to the cases by making a totality, repertorizing it, and the prescription. When we follow this after the prescription, just we can see the magic. Now, a case of what? On teeth of a cow. In my busy OPD schedule, a farmer came up to me and asked for me for a treatment of a what? On a teeth. Here in this picture, I have shown the teeth of a cow. Here, what happens is there are a lot of farmers around my area. There, a lot of cows are suffering with this kind of warts in the teeth. What they do is, if the medicines don't work after giving the conventional medicines, it's very difficult to extract milk in the wart, in the teeth of if the cow is suffering with the wart on the teeth. They will sell the cow itself because they can't manage it. They'll be not able to manage these kind of problems. Also, by giving treatment from the conventional medicines. Some of the veterinary doctors will refer the cases to homeopathy here when these kind of problems when they encounter. So what happened to this case? In my busy OPD schedule, a farmer asked me, "Sir, my cow is suffering with multiple warts on its teeth. Can we able to give some relief by homeopathic medicines?" Yes, I said. So I asked in detail, what is the exact clinical condition of the cow? What the veterinary doctor has said? Yes, definitely. He told me it's a Holstein Friesian cow, HF cow. The wart on the teeth was since 6 months. The cow has been treated with conventional medicine from a veterinary doctor without any result. On homeopathic case taking, I got to know that warts appeared on the teeth after nursing for the 2 months old calf. See the difference here. By not just appeared on the teeth of a cow, it has till that there was no wart. After nursing for a 2 months old calf, warts started to appear on the teeth. So what can we do now? Is there anything in the repertory to offer to these conditions? Anybody who want to type in a chat box, what should be the rubric? How can we go with this case for a cow? If you can, anybody type it in chat box. What can we do for this cow? Can we treat? Can we take this case or can we send it? There is a specific hint here. Each and every case gives us the specific hint. We should hunt for the rubrics. Then we have to repertorize it. Shall I move on? This is the photo. Teeth of a cow having multiple warts. Also, you can see the behind, there's a teeth behind that also having multiple warts. You can see both the things. He has applied a lot of ointments and he has given some injections from a veterinary doctor without any kind of relief or without any result. Before homeopathic treatment. Then, how can we analyze this case? In the repertory, there is a specific thing. Warts, mammae, nipples, nursing after. Specific rubric. We have to search for this. Warts, mammae, nipples, nursing after. The case itself says that the warts has developed on the teeth after nursing for a 2-month-old calf. What is the remedy here? Which is indicating prescription is Silesia. Silesia 200, 3 times a day for a week. Because especially in lower animals, we have to repeat the dose quite often so that the result will be faster. When we're treating a cow, when we're treating a dog, when we're treating a cat, there are a lot of farmers around me who comes with the cat, who comes with the dog for the treatment. So this is the thing, we have to repeat the doses. After Silesia 200 for a week. See the picture now. Farmer has sent me after homeopathic treatment. All the warts has disappeared. Where he has waited for 6 months with the conventional medicines without any result. Now, just after a month, after 15 days, I think, after 15 days or 1 month, he came up with this photograph. Completely, the warts has disappeared. Just a 1 week dose. So this is the potential. This is the strength of our repertory and repertorization. We have to analyze each and every case by making the totality, converting it to rubrics, repertorize it, then the prescription will be easier. So thank you. Thank you one and all for this session. If there is any queries, if there is any discussion, I'll be open for the discussion.
Thank you, Doctor, for the informative session. And it's the time for the discussion.
Yes. Would like to anything about this pityriasis alba case? Have raised the question there. Anybody who wants to ask any queries? Definitely. Yes.
Dr. Harikaran.
Can I stop the share now?
Yeah, sure.
Okay. Right. Yes.
Sir,
Doctor, you can ask.
sir, your case taking, repertorization, these are all very good. Congratulations first.
Thank you, sir.
Sir, I want to know how you are taking the repertory, which selecting the repertory after taking the case. Whether it is through Kender repertory or Boger boning acid or nerve or Pathak or other repertories. How will you how you are selecting that repertory? I want to know that.
Yes, sir. Sir, basically, I have said that according to the case, according to the level of the case, we should decide what approach is needed for this case. When we take a constitutional approach, as I said, with the broad physical generals and mentals, the 3 repertories is very, very important. Kent, complete repertory, and the synthesis repertory. When we go for a single remedy rubric, a lot of other repertories, NAIR repertories are there, FATAC repertory is there. Or also there are some of the single remedy rubrics repertory also in Murphy, complete repertory are there. According to the case, we have to decide what kind of repertory is useful for this case. Then we can go for it. One thing. Second thing is, I'm using this software. The software, I have kept the mode as default. So that when we enter a rubric, very strong striking similar rubric, the repertory itself select. The repertory itself is selected by the software, which is suitable for the rubric. Then it will be easier to go ahead with the repertorization.
Please name that the software. Which is that software name?
Zomeo from Homeopathy.
Zonio.
Zomeo, Z-O-M-E-O.
Please put it in chat box, sir.
Yeah, definitely.
Okay, very good. Congratulations, bro.
Thank you, sir.
That's great. And I think more persons need to ask you to interact with you. Let me welcome other persons also to interact with the speaker. We can hand raise. Dr. Veena.
Thank you for the session, sir. It was mind-blowing, I would say. Sir, actually, this is not regarding this session. Last 3 sessions you have taken regarding the rubrics, how to convert to rubrics. There is a request, sir. Can you please send the PDF across?
Definitely, madam. I have asked this for the group actually. I'm in a different group. I don't know where to send. I'm in a different group. You people are not there in that group. So I kept quiet and I have asked Dr. Danesh sir to share it. And he said there is some technical issues going on. You please wait, he said. So that for that reason, I'm waiting actually.
Since I have written a mail to your mail ID also, but I didn't, unfortunately, I couldn't get a reply from your end.
I haven't got any mail from you. I'll check it in spam. Let me see.
Okay.
If there is anything, I'll send it through mail.
And one more thing regarding the lachesis, what was the rubric, sir? My net has some issues. I couldn't hear that rubric of
The
lachesis.
post-viral cough.
Yes. So
Cough, dry, influenza after.
Okay.
Yeah.
And in Zomeo software, multiple, see for each line rubrics, multiple repertories, it will fetch the rubrics in the same case. Is it possible?
Yeah, you can do that. There is an option there in the settings. You can go and you can customize it. No problem.
Because in radar, what we have seen, like if we select one particular repertory, we don't have the possibility of moving on to the other repertory for the same case. Then we have to totally select all the rubrics from the other repertory which we are selecting. That is why I asked.
Right. No, there is a in Zomeo software, there is an option that if you before entering the case, it asks all the repertory or any specific repertory it asks. If you click it for all repertory, wherever may be the rubric, it will take it into account and it will repertorize it.
And I think a keyword is sufficient to fetch the rubric, right?
Yeah, definitely.
Yeah. Thank you, doctor. Thank you so much.
Thank you. I'll see in my email, in my inbox or in the spam. Let me see that. Yeah.
Thank you, Dr. Veena. And next, let me welcome Dr. Prabhat Bhattacharya.
Thank you, sir. I first congratulate Dr. Gurukiran for his presentation. Just I have some queries. In a single case, can we go with different repertories for repertorization?
Definitely, sir. If there is a need, if there is a multiple symptoms, as you see in the first 2 cases, as where there is a constitutional approach, it has chosen from other repertories. Most of the symptoms covered by complete repertory. If there is any important rubric which has to be taken into account, that repertory will choose itself by the software.
Actually, repertories are organized or arranged in such a manner that if you go with single case with different repertories, result will be different.
Yeah.
It is established.
Yes.
Now, my question is, if with single case, if you use different repertories, what will be the result?
Yeah, I can understand your question. Yes. The answer is, which is a symptom you are selecting? It's very, very important. Are you selecting the mental picture? Are you selecting the whole physical general picture? Or sensation modalities, concomitants? Depends on that. If you have the option in the software that you can choose a single repertory for a single case. If you want to select BBCR, you can only select BBCR. If you want to select only Bonnie Gossin, you can also select Bonnie Gossin. Or if you want to select only Clark, you can select the Clark. Or NER repertory. If you want to use it only NER, you can select. For a single case, you can use that. Depends on the totality of the symptoms.
Okay, thank you.
Yeah, fine.
Thank you, doctor. And more persons. Let me welcome more persons to interact. Let me ask my question. And in a busy OPD, are you using always the repertory, or from intuition or some other thing you are using medicines to prescribe with your intuition only, or with repertories?
Most of the time I use repertory. Every time also, and if there is any striking peculiar symptom, definitely I'll go for a repertorization. I'll search in the repertory. When it confirms, then I'll prescribe the medicine. My intuition also, if the remedy comes in my mind, then I'll go to research again in a repertory. When it confirms, I'll prescribe it.
I think by watching your case presentation, I found that you are giving more importance to the generals and this type of things, the cardinals, and it's great. And can you explain a little bit more to the new young generation doctors the importance of sticking to single medicines or the cardinals for repertorization?
Definitely, it is the core of the homeopathy. Then we have to stick on to that basics, as Henneman has said in the Opinion of Medicine. So it becomes a very important and integral part of a practice for the new young generations and new budding homeopaths. When they start to practice these kind of things, it will be easier and it will be longer. In the longer run, it will be useful for them, and it will be very useful in their clinical practices, and the patient will be benefited out of that. You should not deviate from any cardinal principles. It will be very easier. Some may think that it may be difficult. No, when you take the case in detail, make a totality of the picture, go for the conversion of the rubrics. Please repertorize it. We have got a lot of tools nowadays. So repertorize it, go and then you think of a similimum. Then if there is any doubts, go for Materia Medica, source books. Please read that. If there is any doubt in that, you may differentiate the remedies. Then you can prescribe. We have to work. So that it will be easier.
So repertory is a tool which is making the fineness of which is making us precise how to use the Materia Medica.
Right.
And this will be great. It's a great class. And another question is from Dr. Veena. Here she is.
Doctor, practicing in a city like Hyderabad, I feel like when we are sending the patients for some reports and other things, we generally lose the case. Lose the case. How difficult or how challenging it is for you to practice in the village, not on the treatment aspect, but definitely how are you encountering the patients and how are you convincing the patients to send for all these reports, for lab reports very frequently? What challenges are you facing? I'm just curious to know.
Yes, because there is no difficulty here actually. The trust is like that upon me. I would like to say the trust is like that. They'll wait for me. They'll come far away from a lot of distances and wait for my consultation. And when I say something, and they know that I will not write anything which is unusual like that, simply for just to send for the investigations like that. They'll know that, and I'm going to convey them that if there is any necessity, definitely we have to make sure that investigations has to be done for the next consultation, so that they will not miss it out. When I send them for investigations, I'll say that it is very necessary for this condition for your treatment. Then they'll convince that. They'll go for the treatment, they'll go for the investigations, they come with the reports without any deviations.
And how do you
the trust.
encountered this half-cooked knowledge, the people of Googlers, I would say, the educated Googlers
Yes.
How are you, what challenges are you facing, and how difficult or how easy it is for you to convince them in this approach until the
Definitely.
results are in
Some of the
paper?
patients may ask that this is there in Google, this is there in Google. They'll say that. I would like to say that it may be there in the Google, but it's a 50% thing. So half truth. So if you want to have some results, if you have to have some kind of improvement in the case, stick on what I say. Follow what I would say to you for the case. Then stick on to it. Then go for it. Then results are there in front of you.
That's what it may take 6 months in some cases. It may take for the same remedy. If you
Yeah.
have to exponentially increase the potency, or sometimes if there is an obstacle to cure, if there is a maintaining cost, it may take some more time.
Yeah.
So maybe we may need to retake a case. I don't think all the results are this easy as you show. Definitely, you could have undergone a lot of research in each and every case, and it may not be true that every case is going to get cure in the first visit or in the first.
Definitely.
So in that case, really, it's a highly challenging era nowadays because of the Googling.
Yeah.
So they don't have the patience to stay for even 3 months or 6 months.
Okay.
So that is what I feel. So unless they come after seeing a particular case cured after a year or so, getting to know that this doctor is treating so well, unless that type of patients, they generally they don't wait for 3 or 4 months also.
Okay.
They just disappear. Or if you ask, you go do this test and come, so that we can convince what it was before, what it is now. Once you send for the test in cities like Hyderabad, it is literally very challenging. Okay, that's why I wanted to know all these things, doctor. And can you please drop your mail ID also in the chat box, doctor?
It is there actually in the last slide. I've shown my mail ID. Yes, I'll write it again. No problem.
Doctor, can I speak?
Okay, you
Can I
can.
speak? Can I speak?
Okay, Hariharan, yes, please.
Doctor, in certain acute cases, we are not getting much mental symptoms. Only physical generals we will get. In such cases, I mean, acute cases, which repertory is best for to get the medicine except misimilima?
Only if you get the physical generals.
Okay, only physical generals.
Okay.
And in acute cases, we are getting only physical generals.
Okay.
And in such cases, which repertory is best to find out as
Complete repertory is best.
complete repertory?
Yeah.
Okay, thank you.
Okay.
Next is Dr. Masrina.
Hi, Dr. GURUKIRAN, thank you so much for sharing your cases. This is very good, very interesting. I want to try to understand your prescription. For example, when you treat the fissure in ano, you said you give magnesium.
I'm not hearing you properly. Please, can you speak louder?
Yeah, the prescription.
More louder.
Yeah, the prescription which you said fissure in ano, McMore 200, 2 doses / 15 days. So do you mean that you give 1 dose per week? Because 15 days is like 2 weeks, right?
Yes.
So how do you actually spread the doses? Can you please explain?
Yes, definitely. See, the intensity of the case I'll consider in those kind of cases. Very chronic conditions where the severity is less, I will prescribe only single dose and we'll wait for another 15 days or 1 month. If there is any symptoms severity is there is any irritation, if there is any intolerable things in the patient, I'll prescribe 2 doses. After taking 1 dose, if there is any relief, I'll guide them to wait for some more days. If there is a reoccur of the symptoms, then I'd like to take them another dose. So 2 doses I'll prescribe in some of the cases. Depends on the case. Not in all the cases. Depends on the case.
So for that particular case, the doses was only 2, then you got it cured, right?
Yes.
Okay. Another question about the Lacasis 200.
Yeah.
2 doses per week. How do you do that? Is it once daily? And
no.
then you
1 dose, wait for 3 days. Another dose after 3 days.
All right. Okay.
divided 2 doses per week.
All right. Thank you so much.
Yeah, thank you.
Thank you, Dr. Masrina. Any more questions? And
Anyone
one question is
like
there.
to discuss about the pityriasis alba case? What I've showed there? Why it did not disappear in the 1 year of treatment, other treatment? Why it disappeared in after giving my constitutional treatment? If some dermatologists say it may disappear for spontaneous remission. What do you say about that? Anyone wants to speak about that? No comments in that case. Usually what we encounter, that's why I have showed in for the today's session that if you showcase this kind of case in front of a dermatologist, they say that it's a spontaneous remission. My question is that why did not remit in the 1 year treatment when you're applying a lot of ointments? If it is so easy that only for the assurance it will disappear, why did they assure in 1 year treatment while applying a lot of ointments? What I did, anything special in that case?
Sir, may I?
Yeah.
Yeah, actually, even I have encountered a pityriasis alba case.
Okay.
Actually, it is not that easy as what they say. It is a self-limiting disease.
Yeah.
Because it is little stubborn, actually, though they say. And if they go to the dermatologist, it is even more severe.
Yes.
Because though they say it is a self-limiting disease, immediately the moment they take the child to the doctor, they immediately give the steroidal external applications. So they suppress them. That is first thing. Second thing is, if at all, if they don't give any oils or anything, if they give, after a week, if it is not subside, these parents are impatient and they will go again to the dermatologist, bombard with him to prescribe something else. So they are also forced to give the steroid ointments. This is what is my experiences.
Yes.
So once that ointment is given, since it is a steroid, it suppresses at all levels.
Yes.
The case may be a very simple psoriatic case, but they make it to the core, suppress all the miasms, put the child into more danger actually. So this is the first thing. So what if that 1 month gap, if the child were existing within that sora, probably the child would have recovered at that phase. Because of the steroid application and there is a severe suppression of the miasm, it has not healed within that month. Definitely miasm, and once the dermatologist has treated, definitely the miasm would require anti-miasmatic, that is simillimum medicine only to get the cure, because it should heal from within. So my experience is I took at least a year or so to get clear with the case. Though the remedy was very clear, since the dad of the child was a pharmacist, he will apply all antifungals, anti-steroids, anything, whatsoever, how much ever you give awareness to him. The next week, if the child have a simple itch or it is more in the face, somebody has asked in party or wherever they go, or in the school, if somebody has made a remark, immediately this father will go and apply something.
Yes.
So it was very stubborn, and these cases are coming quite frequently.
Yes.
I don't know whether it is going for an autoimmune type of thing gradually. Eventually, it is developing like that. I don't know. But still, this is my experience, and this is my explanation for those 3 queries. Actually.
Yes. Okay, fine.
Is anyone more to interact with the speaker? Dr. Preeti Desai.
Hello.
Dr. Please, you can ask. Yeah.
Can you hear me?
Yes.
Good evening, sir. I want to know, because I have never treated any animals. So as I saw your case for cow, how you give medicine to that animals, all those animals? How you give a dose?
Pills only I'll prescribe. I'll ask the farmers to directly put the pills, opening the mouth on the tongue.
Okay. Okay, same way like we
Yes,
take.
easily. It's very easy for them also.
Acha.
Yeah.
Okay. Thank you, sir.
Yeah,
Thank
fine.
you.
To evoke the vital force, we need only this very little quantity of medicines. Isn't it right?
Yes, definitely. See, this case of a cow also proves that if that was a placebo effect,
Hmm.
in the humans, they complain that
Hmm.
what do the cow know? Cow knows that it's a medicine. The cow doesn't know anything.
Yeah,
Farmer, just put it on the tongue. The result is in front of you.
it's
Why
a very
did
good.
go in the 6 months of other conventional treatment? They have given a lot of injections, ointments, creams, and all for the teeth. Nothing has happened. Just 1 week after silesia, gone.
Really
Monster disappeared.
appreciable. Really appreciable.
Yes. Thank
Thank
you.
you. Thank you. Thank you. Hmm.
An excellent session. I think we can conclude. And on behalf of IFPH, I thank Dr. Gurukiran for the very wonderful class. And I also thank Dr. Veena, Dr. Hariharan, Dr. P.D. Desai, Dr. Prabhat, and a lot of other Dr. Masrina, who came and interacted with the speaker, and all who presented here on this English session. We welcome you again for this forum. Should come with more. You're a very great, interesting speaker. Thank you. Thank you, Doctor.
Thank you. Thank you.
And let us welcome Dr. Dhanesh to continue the Malayalam session.
There is an announcement. Tomorrow we will have a session from Dr. Lubna Kamal at the English session at 8 p.m. Thank you, Dr. Bindiraj and Dr. Gurukiran.
Thank you, sir.
Okay.